I'm Kevin. Hi, I'm Bill.
Megan. And Esther.
Good evening. Tonight I'll be providing a speech about automated external defibrillators. Survivor, Emmanuel Negadu, college basketball player, suffered sudden cardiac arrest. His trainer responded within 1 minute and revived him using an AED. Sudden cardiac arrest kills an American life every 2 minutes. It is the leading cause of death in the United States, killing 300,000 people every year. That's more than breast cancer, lung cancer, HIV and AIDS combined. Sudden cardiac arrest, or SCA, is different from a heart attack. They are both cardiac emergencies. When a victim suffers from sudden cardiac arrest, the initial assumption of first responders is that the victim is suffering from a heart attack. Let us take a look at the difference between an SCA and a heart attack. SCA is not a heart attack. According to the American Heart Association and Sudden Cardiac Arrest Association, sudden cardiac arrest is an electrical problem, whereas a heart attack is a plumbing problem. Heart attack occurs when there is a blockage in 2 or more arteries to the heart. The blockage prevents oxygen-rich blood from reaching the heart muscles, leading to the heart muscles being damaged. In contrast, SCA is an electrical malfunction in the heart, leading to an irregular heartbeat. According to Sudden Cardiac Arrest Association, sudden cardiac arrest facts, it can either be chaotic heartbeat or fast heartbeat. SCA occurs, both fast heartbeat and chaotic heartbeat can reduce the blood flow to the body and to the brain. Sudden cardiac arrest is a risk. It is a risk to all of us. People who have high cholesterol and high blood pressure are more prone to being a sudden cardiac arrest victim. Sudden cardiac arrest can happen anywhere. According to the Home Automated External Defibrillator trial, it's most likely to occur in the bathroom and in the bedroom. Sudden cardiac arrest doesn't have any warning signs. Due to the reduced blood flow to the brain, a person can just lose consciousness all of a sudden. According to the American Heart Association, 90% of SCA victims will die if the heart is not returned to its normal rhythm within 5 to 7 minutes of fibrillation. Fibrillation, the abnormal heart rhythm, the cause of sudden cardiac arrest. What can you do? What can you do to restart the heart? Early defibrillators were cumbersome and complicated. Operators of early defibrillators require extensive training. According to Dr. Meyerberg, in the study of AED's effectiveness, early concepts of implantable cardioverter defibrillators and AEDs were developed during the 1970s. Coupled with improvements of microprocessors and the high demand for home use for high-risk patients, AEDs were developed during the 1980s. AED is a portable device that analyzes a person's heart rhythm and delivers an electric shock. The electric shock returns the heart's normal rhythm, and the electric shock is not provided if it's not required. AED has 3 parts: the microprocessor that analyzes the heart rhythm, the electrodes that collects the heart rhythm, and the electrode pads that deliver the electric shock. AEDs come in semi-automatic and fully automatic modes. The semi-automatic mode requires an operator to press the analyze button and the shock button. The fully automatic mode requires the operator to press the analyze mode and it does the rest. AEDs require doctor's prescription to be procured. An AED does not require extensive training to operate. The American Heart Association offers a 4-hour training program to properly operate an AED. AED is a solution to fibrillation. According to the American Heart Association, its effectiveness, it has 90% effective rate if it is used within the first minute of fibrillation. AEDs are restricted to time, however. Its effectiveness decreases by 10% for every minute that it lapses without defibrillation. AED is a solution to sudden cardiac arrest. We have to do certain events in order to increase the survivability of sudden cardiac arrest victims. Let us take a look of how AED plays a part in the American Heart Association's chain of relay survival. According to the American Heart Association, even the best emergency medical services suffer delays to emergencies, especially during cardiac emergencies and sudden cardiac arrest. We have to initiate the chain of survival link. That's early access, calling 911, early CPR, early defibrillation using an AED, and early advanced care through hospital emergency rooms. You now have the basic understanding of how to respond and how to use an AED during sudden cardiac arrest emergencies. Let us recap. Sudden cardiac arrest is not a heart attack. It is an electrical problem. AED is a solution for fibrillation. It is imperative that we return the heart's normal rhythm using an AED within the first 5 to 7 minutes of fibrillation. Coupled with the American Heart Association's chain of survival link, we can increase the survival rate of sudden cardiac arrest victims. Survivor: Kayla Donahue, high school soccer player, playing soccer, suffered sudden cardiac arrest in the middle of the game. Police responded within 9 minutes and revived her using an AED.